up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright, they give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. Running in the sunshine, playing with friends. Exercise and laughter, the fun never ends. Drinking lots of water keeps us feeling right. Sleeping well at night time makes us strong and bright. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. In every way. Brush your teeth, keep them clean. Wash your hands, stay so keen. Healthy habits, they're the key to living well and feeling free. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. Brush your teeth, keep them clean. Wash your hands, stay so keen. Healthy habits, they're the key to living well and feeling free. Let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. So let's take care of our body and mind. Healthy choices all the time. Health is wealth, we all can see. A happy, healthy life for you and me. Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright, they give us energy to play day and night. Health is wealth, let's shout it.
Yes, health is wealth, and being healthy makes us proud. Good afternoon, it's Wednesday, the 16th day in the month of July, and it's the second half of the year. How are you? How is this second half of the year going? How is your health? And I know most of us listening, or most of us are at work. How are you doing this afternoon? Yes, stress and everything, but try to manage that stress. Yes, because health is wealth. Yes, you are welcome to the time is 3 o'clock, 4 minutes past the hour of 3, and you are listening to your program You and Your Health on Vicinity 95.3 FM, Ikejile, Ijesha. I welcome to this week edition of your favorite health program, You and Your Health, where we keep you informed on how to live a healthier, how to live a happier life, and get to have discussions with our medical practitioners from different field or health from different field on health related topic. And we get to give you some health information tips also on this program. My name is IBRAHIM, and I shall paddle today's edition of the program for the next 25 minutes thereabouts.
Healthy choices all the time. Health is wealth, we all can see.
Yes, health is wealth, we all can see.
And me.
So on today's program, yes, I said we always invite doctors to talk to us on a particular topic, on a particular health issue, on a particular disease. But for today, our doctor won't be available, and I'll be doing this alone in the studio today.
Healthy makes us proud. Strong and happy every day. Health is wealth in every way.
Yes, health is wealth in every way. Once again, I am Aisha Ibrahim, and today we'll be looking at the topic respiratory tract infection. Yes, respiratory tract infection. But before we look at the topic, what did we know as the respiratory system? The respiratory system is part of our body, is part of the system in our body. The respiratory system is a network of organs and tissue that enable breathing, facilitating the intake of oxygen and the release of carbon dioxide, like the waste product in our body system. So the respiratory system helps protect the body from harmful particles and germs through the filtering action of the nasal passages and mucus. The respiratory system also plays a role in speech, in smell, and regulating our body temperature. Yes, that's the respiratory system, because we are treating the respiratory tract infection. First, we have to look at what this respiratory system is in our body. So today, what did we now know as the respiratory tract infection? The respiratory tract infection is an infection that affects the respiratory system that I explained earlier. So this respiratory system includes the nose, the throat, our airways, and the lungs. Yes, the nose, the throat, our airways, and the lungs. They are the respiratory system. The respiratory tract infections are infections of parts of the body involved in breathing, such as sinuses, our throat, airways, or lungs. And most of these RTI, the respiratory tract infection, gets better without treatment. But sometimes you may need to see your a general practitioner if you notice some symptoms that I will mention later. If you notice it, not all the time that you'll be able to treat these RTIs yourself.
Let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in everywhere. In every way.
So the respiratory tract infection, we have two types of respiratory tract infection. Like I said earlier, our respiratory system has to do with our breathing. So our breathing is from our nose down to our lungs, our airways. So the respiratory tract infection is divided into two types. Yes, we have two types of the respiratory tract infection. So we have the upper respiratory tract and the lower respiratory tract. The upper respiratory tract is considered the airway above the glottis and the vocal cord. And then it is taken as a tract sometimes above the cricoid cartilage. These parts of the tract include the nose, the sinuses, the pharynx, and the larynx. Yes. Then the typical infection of the upper respiratory tract includes the tonsillitis, certain influenza types, and like common cold. Yes, common cold. And then the symptoms of this upper respiratory tract can include cough. You know, the upper respiratory tract is has to do with our nasal cavity to our larynx, which is to our throats. Yes, to our throat. Yes, that's the upper part, and you know the breathing aspect of the breathing part of our body. That's the upper respiratory tract. So these the symptoms of this upper respiratory tract can include the cough, sore throat. You know, I was saying it has to do with our throat. Cough, sore throat, runny nose, nasal congestion, headache, low-grade fever, facial pressure, and sneezing. Yes, that is the upper respiratory tract infection. So I said we have two different types of the respiratory tract infection. We have so now to the lower respiratory tract infection. The lower respiratory tract infection consists of the trachea, which is our windpipe. Yes, the windpipe, the bronchial tubes, and the lungs. Yes, the lungs. So the lower respiratory tracts are generally more severe than the upper respiratory infection. Yes, the lower respiratory tract are generally severe than the upper respiratory infection. And these lower respiratory infections are the leading cause of death among all infectious diseases. Yes. So the two common lower respiratory infection are the bronchitis and the pneumonia. Yes, influenza affect both the upper and lower respiratory tract, but most dangerous strains such as the
reach up to the sky. Healthy food for breakfast, give it a try.
Like I said, the lower respiratory tract affects our airways and the lungs. And the common example of this lower respiratory tract, of the infection of affecting the lower respiratory tract, is pneumonia and tuberculosis, TB. Yes, that's like cough. So what are the causes of this respiratory tract infection? Viruses. Yes, no, the first one of the cause is viruses, and then another cause is bacteria. Yes, bacteria. Then fungi. Fungi is another cause of the respiratory tract infection. And then poor hygiene or exposure to pollutants and smoke. Yes, we are dealing with the upper part of our body, which is from the nose down to our lungs. Yes, so the poor hygiene or exposure to pollutants and smoke. Yes, it's not good to inhale smoke. That's why you always say smokers are liable to die young. Yes, so it's because it affects our lungs down from it, because it affects our lungs and our airways.
It's the key to living well and feeling free. Let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. So let's take care of our body and mind. Healthy choices all the time. Health is wealth, we all can see. A happy, healthy life for you and me.
So what are the symptoms of the respiratory tract infection? If you are just joining us, it's your program, You and Your Health, on Vicinity 95.3 FM. I am AISHA IBRAHIM, and so far we are discussing the topic respiratory tract infection, and we have looked at what our respiratory system is about, the respiratory tract infection, and the types of the respiratory tract infection, because the respiratory tract have to do with the upper part of our body, our lung, from our nose down to our lung, from our nose, the throat, then our airways, then down to our lungs. So the symptoms of the respiratory tract infection, under the upper respiratory tract infection, some of the symptoms are the running or stuffy nose, sore throats. Sometimes they'll be like, my throat is paining me, I have sore throat. Yes, that's the upper part of our respiratory tract infection. Running or stuffy nose, sore throat, sneezing and coughing. Yes, I said the upper part is from our throat, from our nose down to our throat. Sneezing and coughing, mild fever and headache. Yes, those are the symptoms of the upper respiratory tract infection. Then the symptoms of the lower respiratory tract infection include the deep or chesty cough. Yes, from our throat down to our lung. That's the lower part of the respiratory tract in our body. So we have some of the symptoms of the lower respiratory tract infection is deep or chesty cough, difficulty breathing or shortness of breath, chest pain, higher fever and chills, and then fatigue. Deep or chesty cough, difficulty breathing or shortness of breath, chest pain, higher fever and chills, and fatigue. So those are the symptoms of the respiratory tract infection, based on the types of the respiratory tract infection we have. So who are those that have the risk of getting this infection? Who are those that are at the risk of getting this infection? Those that are at the risk of getting this infection include children under 5. Yes, children under the age of 5 years old. Please, parents out there, and it's cold season. Yes, even with the sun is shining and everything, it's the cold season. Please make sure we keep our children warm. Make sure they are always on their sweater. Even if they decide not to wear the sweater, make sure they are indoor to keep them warm. This infection, you don't know where they will get it from. You don't know how they'll be infected. So please, children under the age of 5 are at great risk to get this infection, the respiratory tract infection. Another people is the elder people. Their body is already turning to small age body. Their body system is already weak. So to avoid any kind of infection, please make sure they avoid whatever whatever activities that will cause this infection. People with chronic illnesses like asthma, diabetes, yes, asthmatic patients, yes, there are risk groups that can get this respiratory tract infection, because the asthmatic as an asthmatic patient, your breathing, it has to do with breathing. Yes, at some point you'll be breathing, it will be sounding like whistle. Yes, or maybe you did one strenuous work. Yes, chronic illness like asthma, yes, those are the risk groups, one of the risk people that can get this respiratory tract infection, because it has to do with your breathing activities. Another one is smokers. Like I said earlier, smokers are like they write on their whatever they smoke. Smokers are liable to die young. So some of those that are of risk group that can get this infection are smokers. Yes, smokers. Another person is people with weakened immune system. Yes, people with weakened immune system are also part of the group of people that can get this infection, that they don't even know how they are being infected with this infection. So please, people at risk that can get this infection include children under 5 years old, the elderly people, people with chronic illnesses like asthma, diabetes. Yes, and smokers are also part of this group. Another group is the people with weakened immune system. Yes, those people are groups that are the risk of getting this infection.
Brush your teeth, keep them clean. Wash your hands, stay so keen. Healthy habits, they're the key to living well and feeling free. Let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. So let's take care of our body and mind. Healthy choices all the time. Health is wealth, we all can see. A happy, healthy life for you and me. Wake up in the morning, stretch up to the sky. Healthy foods for breakfast, give it a try. Fruits and veggies so yummy and bright. They give us energy to play day and night. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way. Running in the sunshine, playing with friends. Exercise and laughter, the fun never ends. Drinking lots of water keeps us feeling right. Sleeping well at nighttime makes us strong and bright. Health is wealth, let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in every way.
Yes, health is wealth, and it's your program here on their health on Vicinity 95.3 FM. I am Aisha Ibrahim, and so moving on, we are discussing the respiratory tract infection, and then we are going to be looking at the prevention tips of this respiratory tract infection, so you won't get affected with this infection. First, let's wash our hands regularly. Yes, let's endeavor to wash our hands regularly. I know that yes, the cold weather is out there, but please try to wash your hand regularly. I cannot use cold water to wash my hand. No, the water is too cold. No, please, let's endeavor to wash our hands regularly. Another one is avoid touching your face with unwashed hands. That's why it is important to always wash your hands regularly. Another one is cover your mouth and nose when coughing or sneezing. Yes, cover your mouth and nose when coughing or sneezing. Is either you cover your hand with your with you sorry is either you cover your mouth and nose with your hand or with your elbow. Once you sneeze, there's a particular, maybe you wore a long cloth and something like that. Fortunately, once you sneeze, you just sneeze on that cloth. Apart from that, get always, if you know that okay, you are coughing or you are sneezing, please always be with handkerchief. Even if you are not with handkerchief, maybe with a tissue paper. Yes, you can. It can also help you prevent yourself from being infected. So cover your mouth and nose when sneezing or coughing. Another prevention tip is avoid close contact with sick individuals. Yes, avoid close contact with sick individuals. And even if you are maybe you find yourself among them, anytime you notice that maybe they sneeze or they cough or do any sort of something that can infect you, try to distance yourself a little bit, or maybe try to guide yourself, maybe your nose, your face, with your clothes or maybe with your handkerchief. Yes, because try to avoid close contact with sick individuals. Then stay up to date on vaccinations. Yes, stay up to date on vaccinations, e.g. flu shots, pneumocoria, coccal vaccine. And like for example, during the COVID-19 period, during the COVID-19 pandemic, one of the symptoms of the COVID-19 is cough. Yes, if you can remember, is cough. So that shows how important you should protect yourself whenever you are in the midst of those that are sick, or maybe whenever you yourself sneeze or cough. Make sure you cover yourself. Make sure you cover yourself from the cough and the sneeze. So another one is avoid smoking and exposure to air pollutants. Yes, avoid smoking because it affects the lung, and the lung is our breathing way, is along the way which we use to breathe. It affects the lung. Please avoid smoking if possible. Avoid smoking and exposure to air pollutants. Yes, maybe you are passing somewhere and you notice that that place is smelling, you are inhaling dirt, you are inhaling germs. So try to, maybe it's your clothes, try to use it to cover your nose and your mouth. Yes, try to, maybe for just some minutes, that you'll be able to go away from that spot that you are inhaling bad and smell or something. Try to cover yourself, try to cover your nose.
Your teeth, keep them clean. Wash your hands, stay so keen. Healthy habits, they're the key to living well and feeling free.
And if you notice that okay, you are sneezing, you are coughing, you can also do it. You can go to the hospital or maybe a pharmacy, complain to a pharmacist, or maybe you can go to the hospital, complain to a general practitioner that these are the symptoms I'm witnessing. Then from there, they can prescribe drugs or medications for you to use so that you get better.
Strong and happy every day. Health is wealth in every way. So let's take care of our body and mind.
Okay, our time is fast spent. Thank you for joining the program, You and Your Health, on Vicinity 95.3 FM. And today's episode, we discussed the respiratory tract infection, and I hope that you take along with you one or two things that we discussed today. We looked at the types of the respiratory tract infection, the types, the symptoms, the causes, and then how we can prevent ourselves. We gave some prevention tips. So I am AISHA IBRAHIM, and thanks for joining the program. To my producer Oluwafunke Israel and my manager Precious Ajewole, to my studio manager Precious Ajewole, I say thank you for bringing this program to life. Until next week, same time on our darling radio station, Vicinity 95.3 FM. Stay safe. I remain your host, Aisha Ibrahim.
Let's shout it loud. Being healthy makes us proud. Strong and happy every day. Health is wealth in everywhere. In every way. Brush your teeth, keep them clean. Wash your hands, stay so keen. Healthy habits there.